Welcome again, our viewer. This is again a wonderful time and season to have a wonderful discussion on air pollution in Nairobi and other emerging African megacities. We'll be looking at the sources, sampling, and solutions. And so to begin this webinar, we'll start with an introduction of who Columbia Global Center Nairobi is. We are part of Columbia University Global Networks of Centers. There are currently 9 Columbia Global Centers. This includes Nairobi, Amman, Tunis, Beijing, Mumbai, Paris, Istanbul, Santiago, Rio de Janeiro. Our vision as Columbia Global Centers Nairobi, we are a regional hub for research and collaboration as part of Columbia University's strategy to achieve a global presence and link the continent to Columbia's scientific rigor, technological innovation, and academic leadership. Our mission is to create opportunities in research, scholarship, teaching, and a platform for high-level policy dialogue around the world, and also to engage in community-based initiatives. We have 4 approaches ranging across education, research, public engagement, community-based initiatives. Our programs are around business empowerment, creative and liberal arts, education and knowledge, health initiatives, refugees, and migration. And so to just begin, we'd like to notify you as our viewers that you should keep in mind that this webinar will be recorded, and you're welcome to submit your questions using the Q&A feature at the bottom of your screen. The Q&A session will take place at the end of the session. Features that will be disabled include audio and video sharing, and also screen sharing. And so I'll go ahead without further ado to introduce our panelists. And we want to really appreciate our panelists who have taken their time to come and discuss with us. And today we will have Dr. Dan Westervelt. He's an associate research scientist at Columbia University. We also have Prof. Michael Gattari, who is an associate professor of nuclear science at the University of Nairobi. Joining us is also Priyanka D'Souza, who is a PhD student, Department of Urban Studies and Planning at Columbia University. We have Dr. Darby Jack, who is an associate professor at Columbia Medical College in the Environmental Health Sciences at Columbia University. Last but not least, we have Dr. Godwin Opinde, who is a lecturer at the Department of Environmental Planning Management at Kenyatta University. And without further ado, I would wish to invite Dr. Dan Westervelt to take us over. And before he does that, I would wish to sincerely and apologize for the mishaps that have taken place due to technological problems that we have encountered as CGC. Moving forward, we'll be providing better solutions to these problems that we are facing. Thank you very much. Karibu, Dr. Dan Westervelt.
Thank you very much. While I share my screen here, I will just say thank you for inviting all of us to talk. So I just had a few slides to share just to set the stage a little bit and give us a bit of an overview of air pollution, just so we're all on the same page. So you should be able to see my screen now. So just so we're all kind of up to date, what do we mean by air pollution? Well, we mean a variety of both gaseous and particles emitted from human activities. In particular, we're going to be talking about something called PM 2.5 in great detail today. PM stands for particulate matter. The 2.5 refers to the size of the particles. So we're talking about PM 2.5 as the smaller particles in the atmosphere that are emitted from human activities such as vehicles and power plants and things like that. And these smaller particles are the ones that have the biggest health impacts. They can penetrate deep into your lungs and cause a variety of health impacts, which we'll get into today. And so this schematic on the left is a sort of gives you the size of what we're talking about here. So if you think of a strand of human hair, you know, you can sort of see that in a very small way, but then the PM 2.5 is, you know, would register as just a very tiny fraction of the circumference of this strand of human hair. So we're talking about, of course, invisible particles on the microscopic scale, you know, less than about 2.5 micrometers in size. And air pollution data is fairly sparse globally. So we don't have a good command of what air pollution is like around the world. The exceptions to this are in, for example, the United States, in Europe, and some other places where we do have a decent amount of data, but you'll notice that a large majority of the world here is colored in either gray or blue, which refers to zero or very, very few devices to collect air pollution data per capita, per million people. So zero in gray, you can see most of Africa does not have hardly any PM 2.5 monitoring. Specifically Kenya, you know, we have a little bit of PM 2.5 monitoring, but not, you know, nearly the levels that we need. And this is a unfortunate paradox because a lot of the places that have the smallest amount of data also have what we think could be the most severe air quality problems or air pollution problems. And you see this certainly in places like India and China, which have recently in the last 20 years or so ramped up their air pollution data collection and start to have vast networks of collecting this PM 2.5 data. But in Africa, we still don't have a lot of it. And so we have to rely on other estimates of air pollution in order to understand what the levels are. And so this is a figure from the World Health Organization that's coloring the PM 2.5 levels around the world. So red is greater than 35 micrograms per meter cubed. The number doesn't matter too much, but the point is it's greater than the World Health Organization healthy guidelines. And then the sort of the greens are in the more under that sort of recommended threshold for protecting human health. So you can see that from what little data we do have over sub-Saharan Africa, we think that there could be an issue with air pollution exceeding healthy boundaries. But again, a lot of these estimates are relying on modeling and relying on other less accurate methods of collecting data. So we really need to close the gap of air pollution data on the ground in Africa, so we can know what people are being exposed to and we can know what people are breathing in. Air pollution is a premature is a significant risk for premature death, about 5 million people, and it's unfortunately not well known in Africa, and so we need more data, both on the air pollution data, but also on the health data. And then finally, just to bring it back to specifics for Kenya, this is a percentage of deaths that are attributable to air pollution versus attributable to something else. The blue is percentage of deaths attributable to air pollution, specifically in Kenya. And then the gray is attributed to something else, not air pollution. You can see that for a variety of common ailments, respiratory infections, lung cancer, heart disease, stroke, COPD, diabetes, neonatal outcomes, air pollution ranks as causing something about a third to almost a half of the total deaths attributable to the particular disease that's listed here. So that's sort of our brief summary. And now if I can stop the share, and we're going to switch gears a little bit into a more question and answer panel session. And at this point, we'll start off with a couple of questions, predetermined questions for the panel, and then at any time, audiences, you are welcome to type in your questions into the chat as we go along, and we'll be into the Q&A, and we will monitor that and ask those as we go. So I'm going to start off with a very simple and kind of question to kick us off, and that's what is the state of air pollution in Nairobi, in sort of the urban center, in the surrounding megacities, or sorry, in the surrounding rural areas? What exactly is the current state of air pollution in Nairobi? And so I'd like to call on Professor Guattari to start with that.
Yeah, thank you, Dan, and good afternoon, everybody, and thanks, Caribbean University, for inviting me to this webinar. Yeah, that is a question and a half. I can only talk of the urban Nairobi. Probably I can mention a bit of rural Nairobi, but the measurements of air pollution in Nairobi has not been as good as we would expect, or as much as we would want. But one thing I can tell the audience is that the air quality in Nairobi is not good. In fact, the figures I've seen done fruit there are a bit misleading. And I'll give you an example. From reference data which we have, and at around 17 meters above ground level, we are ranging around 20 to 30, well, maybe 35 micrograms. That means that is seen as below World Health Organization. But that is 17 meters above ground level. And it's likely the data which is reflected there for Kenya was picked from the publications we have done. I've seen Gaita, one of them was Gaita et al., where we measured at around 17 meters above ground level at UNEP and University of Nairobi. However, with that kind of concentration at that level, estimation on ground level around 1.2 meters will give you 60 to 80 24-hour microgram, which is nearly 2.5 times the expectation of all the recommended values by World Health Organization. And with that, I can assure you, most of these data have come from ground level measurement in 2011, where Columbia University was participant, and I think Priyanka is working in that group. Center for Sustainable Urban Development is the one which funded that short project where we were along the streets of Nairobi. And that said, there are few data, short-time data, but reference data. And I think we should go with that. A long time back, we had measured some data in my hometown, which now is another piece of Nairobi because it has grown very fast. And I think it's one of the fastest growing towns in Kenya, at the bottom of Kenya, called Nanyuki. And I assure you, the air pollution levels from sources from motorbikes, which are very common, from transport, Nairobi, you can't even move, from waste burning, to our understanding and our measurements, industry is not even a big issue. It's only a big issue at sometimes at night because they don't control them very well. But then the amount which comes from the industry, since they are not as many, compared to motor transport and others, is very little. Of course, there is a lot of biomass burning. We have a lot of smoking vehicles also. So all I can say at this stage is air pollution in Nairobi, in which case when you come to the technical term of air quality, which is a quantitative term, it is not good for human health. And I think I can put that so that others can have a chance, and then the audience can provoke other issues which the panelists cannot be able to give on the floor. Thank you.
All right, thank you, Professor Guattari. So I'd like to give each of our panelists an opportunity to talk about this particular question. So next I'd like to go to Dr. Godwin Opinde.
Thank you, Dan. And thank you, the panelists, my fellow panelists, and also the audience. I'll join Prof. Guattari in stating that the air quality or the state of our air within Nairobi, for instance, and urban areas, from the previous data that is also presented and talked about, I would say is not good. And probably we have this situation where we have ad hoc studies and no continuous monitoring for quite a while sometimes. We cannot give it conclusively, but the indicative thing is that it is not good. And if you look at the sources of this pollution, you find that these activities have been enhanced within the urban areas. If it's the burning of waste, if it's the transport sector, and you can see from whatever is happening around that there are no proactive intervention measures towards this. And so this situation might just be worsening. I would leave it at that. Thank you.
Okay, great. Thanks, Dr. Opinde. And now I'd like to invite Priyanka D'Souza to discuss her thoughts on this issue.
Thank you, Dan, and thank you, Michael and Godwin. I'm going to agree with you. Air pollution levels in Nairobi are a cause of concern. And even though there is so little data available, there have been many studies, many of them conducted by Professor Guattari over the years that have shown that that have provided consistent evidence on the importance of certain sources. And transport is definitely a big one. There have been studies that have found that air pollution levels by major highways, etc., are really high. There have been studies that have shown that black carbon levels, black carbon is a pollutant emitted by vehicles, are some of the highest in the world. In addition, there has been work done by people such as Dr. Andriana Mabandi, who has measured the fuel economy of vehicles in Nairobi and has shown that they're extremely poor, especially in comparison to the countries from which many of these vehicles are imported. So all of this to say is that we know, even though there is a dearth of data, we do know that air pollution levels are a cause of concern. And all of the important studies done over the years provide consistent evidence on the importance of certain sources. And I'm going to argue that that is enough for some action to be taken.
Great, thanks, Priyanka. Last but certainly not least, I would like to invite Darby. And one final thought before we do that is that if any of the panelists want to sprinkle in some of their other experiences in other major African cities, that's certainly welcome, as we are the Columbia Global Center Nairobi, but we are also focused in this webinar on other major cities in Africa as well. So that would be a welcome addition for anyone. So Darby, go ahead and take over.
Sure, thanks so much, and thanks to the organizers. It's a real pleasure to speak with all of you about this. So I want to make 3 points. I approach this question from the point of view of health. I'm a scientist who focus on the health effects of air pollution exposure. So the first point I want to make is that the air pollution levels in Nairobi are unequivocally unhealthy. There's no scientific uncertainty about that. We know that people are dying. We know that people are getting sick because of the air pollution levels. And we'll talk a little bit more about that in a moment, I think. And one thing that we're learning as we do more research on air pollution exposure and health is that even low levels of exposure, well below what is seen in Nairobi has a health impact. So the science is really clear on this, and we need to get a lot cleaner if we're going to eliminate this risk or even substantially reduce this risk. The second point I want to make is that exposure and risk from air pollution are not evenly distributed. Professor Guattari mentioned that the background levels are, maybe not the highest you'll see in different cities across the world. But the measurements that have been made, especially in low-income or slum and informal communities, show that people who are living in those informal settlements are exposed to levels that are 5 or 10 times higher than those background levels. This excess exposure in these marginalized communities is coming from local sources in large measure, from cook stoves, from traffic, from rubbish burning, from local sources in these low-income communities. And so really keeping in mind the disparities in impact is important. And then the third thing I want to say, and I think you'll be hearing this throughout the seminar, is that we need more data. I guess the spin I would put on this is that we need more data that really illustrates how exposure varies across neighborhoods and also on personal exposures to air pollution. So what are the actual exposures that people experience? What are they breathing in as they go about their daily lives? So I'll leave it there and turn it back to Dan.
All right, thanks, Darby. So we have a number of really good questions already coming in. And so I'd like to turn our attention to those. And I'm going to synthesize a couple of them into one big question that the panelists can answer. And if you'd like to just take a piece of the question, that's fine too. So the question is specifically about Nairobi, and it's about how many air quality stations that measure PM 2.5 do we have in Nairobi? That's part one. Part two is, how do we increase that? How do we get more data in Nairobi and beyond, in other parts of sub-Saharan Africa? And then the third part I want you to consider is, can we piece together pre-existing data that's already been collected? So in a lot of cases, there's been data that's come in and collected for 6 months, and then for a year, and then for another few months after that. It's a little bit disjointed. Is there any possibility of piecing together these various measurements to forming an overall baseline that could work as a long-term picture of air pollution? So that's a complicated question, but the point is basically, what's the current number of air quality stations, and what can we do to improve that amount and that quality of data? And for this, I'd like to start with Professor Guattari.
Yeah, thanks, Dan. Again, the number of the number of monitoring stations or units, to me, I really don't know, and I don't know who knows how many they are, because there are many researchers from the north who are already in the country who are doing their own bits and pieces, and where they have located their monitoring stations is unknown. Which is, at the end of the day, it is good if all this data comes out one way or the other. The channel for data coming out, obviously, I would guarantee that it is after publications that the data can be availed, because most of these people have to prove to the funding agencies that they took their funds and they have advised their peers what they have found. You also asked if we can contribute. I was involved in one study in Cairo some years back, many years back, I think. Yeah, and the air pollution in Cairo was very bad. And I think Nairobi is only but an example. Because if you look around Africa, the slums or the unauthorized settlements are highly populated, and the populations continue increasing. And that is the biggest threat. And the population is increasing in these settlements, and these people cannot afford their daily meal. They also need energy to cook the little they have. And the consequences is burning more rubbish, anything they can get which can at least cook the food, if not for warming wherever they live, because warming at night is also an issue. These are factors which people should consider. And also the factors, well, I don't know what was asked next, but then there are other factors, economic factors, which are involved in what we would expect tomorrow's implementation. But the knowledge base can only be improved by more measurements, and the low-cost monitors which are already being availed from the north will help. That data will be important in future, even if we are not able to do anything currently. Reference data will remain scanty for quite some time because the instrumentation required is expensive, but we need to understand the spread of air pollution contributions from all corners, indoor, outdoor, and even in rural settlements. And preferably, like Dabi has said, the Nanyuki data some 10 or so years ago, or more than 10 years ago, was not good. And there were only a few, around 300,000 settlements. Today, I am sure they have multiplied. Two, like Dabi have told you, and be aware of this, part of the particulate matter and emissions from the vehicle is carcinogenic. That means it causes cancer. And some of those have no limits, how much, and they all come from the ban. And this is very common when you ban rubbish, electronics, things, you have seen the kind of rubbish in Nairobi and the kind of people who are banning them. Let me not occupy the whole story. Let others contribute a bit. Thank you.
Okay, thanks for that response. I think there were a couple of very good points in there, many very good points actually. And one thing that may be worth reiterating is the need for greater cooperation and coordination amongst different groups. You mentioned folks from the global north coming in and making measurements, making sure that data is publicly available, making sure that data gets into the hands of people that need it, that can use it to take action, I think is really important. So on that note, I'd like to turn it over to Priyanka to talk a little bit about the idea of using low-cost sensors to improve air quality data coverage in Nairobi. And she has a lot of experience with that. If you could just give us a little bit of background on low-cost sensors and what kind of potential you see for them to be used to improve this data gap that we have in Nairobi and elsewhere, that would be great. Thanks.
Thanks, Dan. Actually, I'm going to post a link in the to everyone. It is this website called openaq.org, which basically absorbs all publicly available data from reference monitors and recently low-cost sensors. And you can, if you can go to Nairobi and you can see that there are a few low-cost sensors already operational in the city. In fact, like the monitors that are currently providing information are these low-cost sensors. But I'm going to back up and explain what these low-cost sensors are. So they're monitors that cost less than about $2,500 and this is like a US EPA definition, which may or may not be low cost depending on what your budget is. But they're definitely less expensive than, say, the official air quality monitors, which can cost tens of thousands of dollars, as many of the panelists have mentioned. What then is the trade-off? Although they're lower cost, they're not as accurate as reference monitors. And so interpreting the data then becomes extremely difficult as there are so many low-cost sensors in the market and they all behave differently and they all have their own quirks. So in order to be able to develop insights from these data, it's important to understand, the data quality, which is difficult. It is so difficult that in many cases, people have said they're not actually low cost because you have to invest all of this energy into sort of making sense of the data. And you need, and so far that has really been in the realm of experts who have been co-locating these devices with higher quality devices, developing ways to calibrate these devices to then get more high quality results. All of this is well and good, but I'd still argue that low-cost sensors provide indicative values of air pollution. And by this, I mean, although the exact value of these sensors is subject to a lot of uncertainty, in general, they're pretty good at giving you an idea of long-term trends in the city. So especially if it is difficult and if it is time-consuming to have these higher quality instruments, then low-cost sensors can provide some useful information about baseline air pollution. And one of the things that I want to say is that Code for Africa, for example, is one of the groups that has been deploying locally made low-cost sensors. And you can go to sensors.africa to view this data. And they're partnering with journalists to measure air pollution in places that people worry about. So this is something, this is like an innovative use of these low-cost sensors to keep tabs on important sources of pollution. There are other low-cost networks. Dan is leading a big effort in Nairobi, but I think it's really worth paying attention to this data, given how difficult it is to use reference monitors.
Thank you very much for that overview and the potential of using low-cost sensors. So I'd like to turn it over to Dr. Opinde and sort of ask the question, in your opinion, what do you think is the best way to increase our amount of observational data in Nairobi, but also across Africa?
Thank you, Dan. From the discussions already, the indicative way is to investment in local sensors. For me, I think would be a plus. And where the downside of it is that maybe we lack that collaborative effort, or we lack that platform for networking where this data can also be shared easily. And because if you look at the first question you asked, how many monitoring stations do you have, or devices do you have within Nairobi? And we absolutely can't answer that because there's that lack of coordination. So every group of every person, researcher comes in with his local monitor and does his research, moves, and that collaboration and networking within these researchers are also institutions such as the county government that's actually has the mandate to look at air quality. I mean, issues of air quality management need to be fostered so that we actually harness on this data. Having said that, you did ask about how we can really enhance this. I think if we invest, apart from collaboration, if we invest also the local governments or authorities would invest in some of these instruments, it would be a plus, because actually now it means it would be a budget line item, and maybe issues such as maintenance about this and continuous monitoring would actually be taken into account. So for me, I think it's something that needs to be taken up seriously by, if it's for Nairobi, the Nairobi County government, if it's Kampala, KCCA, Kigali, the local authority involved, and that would help us leverage a lot from this kind of data. Thank you.
Great, thanks for those points there. That was excellent. So just a reminder, keep sending your questions into the Q&A. We're sort of answering them as we go, and I'd like to switch gears to a couple of questions that have come in surrounding the issue of health effects of poor air quality. And so this is obviously a big reason that we care about air pollution. And I'd like to go to Professor Darby Jack to sort of give us first, just give us sort of an overview of what are some of the health effects of air pollution.
Dan, I wanted to put in one thing before I probably if I'm not interfering. And this is related to the way forward and the fear with this, my assessment over the years of the fear involved with the policymakers is the way we have been promoting the information is as if we want to shut down the economy overnight. But I think research is not meant to kill the activities as they are going on. Is meant to bring in information which can be used in future when the state of affairs is conducive to some certain implementation. The other biggest problems, even foreign investment in instrumentation, is the knowledge base. The knowledge base on air pollution and air quality is so low. And even in those countries, the competency needs to be, we need to probably invest in that area so that more people can understand. Even those people in industry, the factories, some of them just do very queer things as if they don't care about the human health because they think themselves they are better than the other human beings, which is because of lack of understanding. Thank you. That's all I wanted to mention as we go on.
Okay, thanks. Do any of the other panelists want to jump in on that before I switch gears? Okay. If not, I'm going to turn it back over to Darby for a quick overview on some of the health effects of air pollution.
Sure. So as Dan mentioned in his introduction, there's a fairly long list of diseases that have been linked to air pollution exposure. This includes chronic obstructive pulmonary disease, childhood pneumonia, stroke, heart disease, low birth weight, lung cancer, and then there's quite a number of other health outcomes that have been linked in a few studies, but not a sort of large body of literature. And collectively, these different diseases result in or air pollution operating through the causal pathway of these diseases results in a lot of disease and a lot of death. And there was a question that came up in the chat about how well localized these relationships are. You know, we have good evidence from the United States or good evidence from the European Union of, say, the relationship between air pollution exposure and lung cancer. But we don't have studies for Nairobi. And so what do we do? So basically what the science community has done to deal with the fact that we don't have studies for each disease and each kind of exposure in each place is to build up sort of generic curves. So these are functions that relate air pollution exposure to risk. And these curves also, these functions rather, in addition to accounting for the level of air pollution exposure, they also account for the population that is affected. So they account for the age distribution, they account for other risk factors and sort of the baseline level of risk. So there's some localization of these relationships that are built into the modeling approach, but there is a real gap, and there is a need for good epidemiological research in places like Nairobi. The other thing that I would call for, though, is I think there is need for good risk assessment in places like Nairobi. Preparing for this webinar, I did a little bit of reading to try to understand what risk assessments have been done to date, and there's not a lot. There's definitely room for more use of existing knowledge, the existing air pollution measurements that we have, these existing exposure response relationships that have been well characterized and sort of agreed upon by a consensus of scientists. And so I think there is a real opportunity to come up with Nairobi-specific risk estimates. And I do think those risk estimates can help drive the policy conversation. If we have real numbers or at least reliable estimates of how many people are dying from, say, lung cancer in Nairobi each year from air pollution, that carries a powerful policy message. So I guess the final thing I want to say is related to what Professor Katari and others have mentioned about sort of the path forward. And I just want to stress that a lot of places have made progress on this issue. This is an issue that we can make progress on. It's not, you know, it's not a monolith that we just have to accept. And you know, cities like, say, Mexico City, which is another sort of middle-income city, has made tremendous progress on the air pollution issue. And you know, as Professor Katari said, we need to prioritize economic development. That's, you know, poverty is the sort of bedrock issue that must be addressed. But I think what we need to do is address poverty while we pay attention to air pollution. And I think we can save a lot of lives if we can do those things at the same time.
Yes, thanks, Dabi. Yeah, I think you are very right that the knowledge based on the impacts of air pollution has to continue. There is obviously some of the information which comes up on cancer in Nairobi are scaring. The amount of money spent outside Kenya in cancer treatments are very high, but this information is not well organized, is either, you know, I guess the medical fraternity in the country and the public health have a lot to do also, because other than what we talk and do measurement and the figures we put forward, there is no direct assessment which actually is related to us as justified. Yeah, I can give you examples. Is that many years back, 20-something, over 20-something, because I think that gentleman is retired now, was in World Health. He was somewhere in the neighborhood of Saburu in Kenya, and he measured 2,000 micrograms per meter cubed in one of the small houses because he stayed there. And I think he did his PhD, Ezati, somebody called Ezati. He did his paper was in 2000, and 2,000 micrograms, which was crazy. But of course, the instrument, but the indication was that it was not good. And this is true. In the poor communities, in the rural communities, indoors, and even in the settlement sectors, I'm missing the correct word for that expression, but let me call the slums. The conditions indoors are excessively very bad. That's why the children are growing. It is cold at night and they have to be warm. They have to burn, bad sources of air pollution. We also know there are some species of chemicals within leave alone even going to gases, particulate matter alone, which are highly carcinogenic. But in this region, the concern has been concentrated on water. By the way, in a country like Kenya, I think that if any air quality or air pollution issues have come up in any policy, it must have been recent days. There has never been any mention on most policies on air pollution until I think probably 5 years ago, and not all policies. And that's why I think Godwin and the county government and Stockholm Environmental Institute are busy with the county government of Nairobi trying to put in. The point is the diseases, the complex of diseases from air pollution is even not picking cancer or any other single disease, but a weakened body. The breathing system is a source of weakness to the body, and a weak body is very conducive to getting any disease you can think of, leave alone anything else. A weak body can get any disease in any exposure. And air pollution is a heavy contributor to weakening the human body. If you consider what happens when all these particles and gases gets through your respiratory system and the oxygen exchange and all that in the body. So the reality is there are many, we shall have data, but we also need a step from the public health to come up and assess in this locality with this kind of air pollution, how many people can be indicated, it can be seen to have passed or visited clinics on this disease, which could be related to air quality. And these are the issues. But then to reach the policy makers, is I go back to Majid Desati, is that most of the policy makers are born in those conditions and brought up. So they have spent nearly 15, 20 years in those conditions. It's like in US or in the North, getting a lady who has been smoking for the last 70 years and is alive. These are the examples they give. So there has to be concrete data and a good approach that you don't compare human health of one individual to the population. You have to have a cohort, a large data. Don't say because I was born in that poverty, 20 years I've been in that smoky place, conditions are bad, we have been manning this and this, I'm still alive. Those are some of the examples you hear from policymakers and members of parliament, for that matter. So we have to look for ways of dealing with this. And I'm putting this forward because I think many Kenyans are in this forum. And unless the knowledge base is apt so that they understand, it is also not going to be easy. Just like COVID. You see, the COVID issue has not been expressed the way it is placed in the air very strongly. Because even if you try to talk about it, if people don't understand what happens, then it is difficult. So we have a tall task to do. And it is for everybody to go and spread the message. And I think that's what I'm saying. The more measurement, the more activities in air quality from whatever corner of this world, I personally don't mind. It also creates awareness, because awareness will be critical. And in the course of that, you pass the knowledge, you increase the knowledge base. Let me not talk too much, because this is an area which gets in my system sometimes. Thank you.
Thanks, Prof. Maybe to just add on what Prof has said, the air quality health nexus, without even measurements and just observing the activities within the country, or the planning within the country or even the cities, one thing I'd like us to note is that looking at, for instance, Nairobi and the informal settlements within Nairobi, those people who live in informal settlement are actually exposed to poor air or poor air quality like 3 times. Is a triple effect. Indoor, from the fuels that they're using; outdoor, when they move from their places where they're staying; and then also they're exposed where they work. Because if a majority of these people from maybe informal settlement deal in many jobs or work in industries. So it's actually a great concern, and I think building a body of maybe evidence in terms of health and air quality nexus is a plus. But even so, as this is going on, I think it's something that can be picked up with serious awareness campaigns, so that policy makers can also take it up seriously. So the knowledge gap is something that needs to be addressed to make this effective. That's what I would say. Thank you.
Yeah, if I can add just a small shot. In fact, Nairobi is prone to what we call inversions. And when inversions come down and the whole pollution of overnight is locked on Nairobi, the way you wake up, you can feel your breathing is definitely impaired. You don't need to go to any measurement. Some days you are okay, and some seasons, but there is frequent temperature inversions in Nairobi. They are consistent. It's well known within the weathermen and so forth, and people in climate knowledge base. And that one alone will tell you that air pollution is dangerous. And when you are that weak, even the thinking capacity is also impaired. The other problem is, we had a case, or rather I know, I'm not going to mention names, where one of the factories was being investigated and they were switching off the factory when the measurements were going on, and then putting on. The people who work there are from the same slum area or informal settlements who had complained, so they are intimidated, so they cannot stop. Otherwise, and you can see poverty related to inhibition of progress. And they knew, their managers, their supervisors, they knew what their bosses are doing. So obviously the consequence result was rubbish.
I wanted to switch gears just a little bit and talk about policy. And in particular, we already hinted at this a little bit as we were going, but if people could, if the panelists could tell us what policies are currently in place in Nairobi, and what kind of policies are being considered and might come to the table in the future. And I'd like to start with Priyanka on that one.
Thank you, Dan, and thank you, Professor Gattari and Dr. Opinde, for your overview of, the limitations in the current policy process. I'm going to sort of give you a landscape of the current laws and regulations in place that that exist around air pollution. So one, the Environmental Management and Coordination Act was implemented in 1999. Is sort of the umbrella law for management of the environment. And in 2014, the air quality regulations were enacted in the Environmental Management and Coordination Regulations in 2014. And these regulations included setting standards for air pollution. So if you actually Google EMCA 2014, you will find the standards that exist for Nairobi. This act also designates, also requires emissions from vehicles to be monitored. It requires emissions from industries to be monitored in real time by laboratories by designated laboratories. All of this is to say that there are policies in place. But what is the limitation here is the implementation, because although we have air quality standards, if you don't have an official air quality monitoring station to measure air pollution to compare with these standards, these policies cannot be implemented. In 2010, the new constitution, however, devolved air pollution to the county level, devolved all environmental matters to the county level. So now counties are also have an important role to play in sort of protecting their residents from air pollution. As of now, I know Nairobi County has actually sort of provided a roadmap for how they would think about monitoring, etc. And this is a really important conversation to follow. So the upshot is, like, all of these policies and regulations are in place. There is a huge problem in coordination, which agency is responsible for what, and there's still huge gaps in implementation that must be overcome for these policies to actually take effect.
Thanks, Priyanka. So I'd like to pose the same question to Dr. Opinde.
Thank you very much, Dan, and thank you, Priyanka, for highlighting some of the policy and regulatory regulations that actually help in managing air quality in Kenya. To add on what Priyanka has said, the county government, of course, through efforts and partnership with other like-minded stakeholders, I've moved a notch higher. I know they did their air quality monitoring action plan for air quality. They are also having the policy, air quality policy, which is out for public participation. It was actually, I went through the county assembly and is out for public participation. If you Google air quality policy for Nairobi, you'll find it. It's out for public participation. I'm also aware that they are working on a bill at early stages of formulating a bill as some of the instruments that would eventually help in managing air quality within the city. This is also happening in several other cities, especially in East Africa. But then one thing that I wish to underscore is that as much as we have these regulations in place, policies in place, they happen to be some overlaps and duplication in some cases, which is actually is an avenue for weakness in policy framework, and that would be key in enforcement, because sometimes it weakens enforcement. Another thing I'd wish to note also, as from the policy aspect, as Priyanka underscored, the implementation is a key challenge. And I'm not well versed with Nairobi City Council, but I think even budget item that is directly linked to air quality would be likely missing in the budgeting. So it means resources follow the plans, but then sometimes priorities within these sectors. And this is influenced by actually how they view, or the politicians or the lawmakers view the problem at hand. So in terms of policy, I think we're making good progress within the city and East Africa as large. I know countries and local authorities are working towards this. I know in Kigali, they have, for instance, even in Rwanda as a whole, they have put in place standards for vehicle emissions, and they are also progressing in terms of issues of air quality management in terms of policies. So for me, what I would still underscore is that with these policies in place, it's a plus. But then the flip side is the resources that actually help in accomplishing some of, accomplishing issues of air quality management. And that is very, very key. Thank you.
All right, I think Darby has a little bit to add to this policy question as well. Go ahead, Darby.
Sure, yeah, just a couple of points to make here. The first point is that there's no silver bullet. There's no one policy that is going to solve the problem. What I think we can learn from places like Mexico City, which I mentioned earlier as an example of a large, complex city that has made real progress, is that what's required is ongoing measurement, source characterization, and environmental managers that have resources and power. In Mexico City, it's really the main improvements, as I understand it. I'm not a student of that place, but as I understand it, the main levers, the main policy levers that have been pulled are controls on traffic, both on the amount people can drive and also on the emissions from vehicles through more efficient vehicles, investments in public transportation, and then investments in solid waste management, so people aren't burning their garbage. And there's a much longer list, but my understanding is that those are some of the big ones. But they're policies that are addressing specific sources. Some of them are very long-term investments that won't pay off immediately. They all have important co-benefits. So this is a really important point here, is that many of the things that we will do to reduce air pollution will also reduce emissions of greenhouse gases, which are responsible for climate change, and also just improve quality of life. Nobody wants to be walking down the street if it's cluttered with garbage, for example. So many of these policies have really important co-benefits that go beyond air pollution management. And I think what we need is a policy approach that's intelligent, coordinated, and adaptive, that's flexible and can respond to the science and respond to the learnings that occur as policies are deployed. And then the final point I want to make is that I think it's to the extent possible, it's important to really collaborate with the private sector to find ways to work with the companies that might be contributing to air pollution emissions, but to find a way to bring them along and not turn them into enemies. But at the same time, it's important to have ironclad enforcement mechanisms. So I'll stop there.
Thanks, Darby. So a lot of good points there to build off of. I just want to note that a lot of people have brought up, existing air quality policies in Nairobi for the Air Quality Action Plan, and one of the panelists, Priyanka, has posted that information in the chat. So if you're interested in, what's going on already, you can follow her links. Darby brought up the point of co-benefits, and there was a question a while back that I wanted to make sure we didn't forget. And this question brings up the idea of economic development not coming at the expense of environmental protection. And there's been, a great example in the US that the Clean Air Act, which is 50 years old now in the United States, has greatly reduced air pollution in the US. And there's been an expansion in the economy, and there's been economic benefits specifically from that that policy. So, is there, specifically in translating that to Kenya policy, is there a way that we can learn from, for example, the Kenya Climate Change Act of 2016, an action plan to drive policy frameworks for air pollution? What are some of the co-benefits that may come from that, both economically and environmentally? And what kind of benefits can we see? How long will it take till we see them? I would like to invite any of the panelists to sort of tackle that question.
Dan, let me comment here, although I don't want to be extensive, but the core benefits of environmental protection, especially air quality, are very high. It is the understanding which is the problem. Because if the amount of people who get sick in a certain environment, in a certain industrial investment, in a certain industry, they go to sleep. They don't go to work. And 1 hour or 2 hours of specialists or even skilled personnel in an investment cost that investment and consequently the tax-paying capacity to the government. 2, that person will try to go to hospital where the cost is another issue and deprive the poor families a meal. So, to me, economic benefits, if you can protect people from environmental dangers, are very high, and that's why air quality in the UN development, what do you call this now? In
Sustainable development.
Sustainable development. Yes, sustainable development goals. You find air quality RERA, if you investigate properly, it is part of most of those development goals. In every one of them, if you investigate it and analyze it, air quality has an issue to fry in. And by extension, by the way, the same poor air quality is the one which impacts on total air pollution in atmospheric systems, and consequently the climate problems and the certification. We can go on and on. The deforestation, the drying of the land. Kenya had very large forests. It is gone down and most of the places are drying up. Nairobi itself, underground water in Kenya has been sinking. You have even seen houses where there used to be water before. So it's only the knowledge. If we focus to make sure that most people understand what it is all about, without too much activism, if we can focus on the industrialists to understand why they should protect their workers from bad health, from poor quality in the industry, then things will be better. Thank you.
Great points. Thank you. Would any of the other panelists like to answer that before I move on to the next question?
Yeah.
Yeah, go ahead.
Yeah, no, I mean, I agree that the Clean Air Act, for example, despite the high cost of all of this infrastructure, of all of these reference monitors, given the number of lives that the Clean Air Act has saved, because it has resulted in decreases, in sustained decreases in air pollution. I mean, you could say that the Air Quality Act has actually made money for the US government because they have a healthier workforce, they're spending less money on healthcare, etc. So the argument about cost, when one considers the benefits that these policies and laws can provide, sometimes can fall flat. The other thing that I want to say is, and I'm really glad that Victor brought up the the Climate Policy Act. As we know, one of the biggest challenges is coordination between the different organizations, and everyone is doing their best, and it's incredible to see the Nairobi County action plan. And it would be amazing to use the Climate Policy Act, which has designated clear roles for different organizations, sort of replicated in the air pollution space. The last thing I want to say is that although we have all of these policies, air pollution is also an urban planning problem, and right now it's sort of tackled in a silo. And given what we know about highways, etc., being sources of air pollution, it's important that when Nairobi makes urban planning decisions, such as say the building of this new expressway, that air pollution considerations are factored in, because that might change the calculus of lots of these urban planning decisions. So we need considerations of air pollution to sort of be integrated into the system as a whole, and that's something that we could perhaps learn from the way the Climate Act has been enacted.
Great. Thank you.
May I just jump in here for 2 seconds?
Yeah.
And say, so there was a benefit cost analysis of the Clean Air Act done by the United States Environmental Protection Agency, and they found that for every $1 of cost associated with the Clean Air Act, there were $30 of benefits. So a 30-to-1 benefit cost ratio. So an extraordinary return on investment. If somebody told you that there was an investment where you could invest $1 and get $30 back, you would run to make that investment. So I think the message from these kinds of analyses is that investments in air pollution control are hugely advantageous for society.
Yeah, that's a great point. Oh, Pinde, did you want to add something on that?
Yeah, I think there is a co-benefit looking at the climate change acts that we have, and also the plans that we have, like the Climate Change Adaptation Act of 2015 to 2030, and the climate change policies generally in place. These are some of, I think, the avenues for leveraging. And having noted that we have the climate change, we have the air quality regulation, which of course, in a way, provides the avenue where through maybe the environmental impact assessments and that are carried out for projects. Priyanka mentioned about the highways, somehow incorporate issues of air quality measurement. I know the challenge to this has been instrumentation. That's very key, has been a challenge. And so for me, from my standpoint of view, I see there is a lot of co-benefits when we have mitigation measures, which are inclined towards looking at the quality of the air, which also end up in as mitigation measures for the changing climate. So I'll stop at that point.
Okay, great, thanks. So we're coming up on almost the end of this panel. So I want to get to one big last question. And we can all I'd like to invite all panelists to talk about this one, but the question is going to be, what do you see as the biggest barrier to cleaner air in Nairobi? And also, what can the public do to support cleaner air in Nairobi? And I'll start with Professor Guattari on that one.
Yeah, thanks, Dan. This one is a tall one for me, because sometimes over the years I have tried to think about it and I haven't come up with a good recommendation or solution. But reaching out to the public and letting them understand, first, educate the public. Let them understand the implications of poor air quality into their homes, on the streets, when they burn garbage without sorting it out and so forth. The other thing is that let the owner, the investors also be given the message clearly of how they are hurting their own investments. And an investor who have lost a skilled person even for 2 days and tries to look for another one would understand very quickly what it means to have a healthy skilled worker. The also is that the issue of the air quality source, the driving force and motivation of air quality globally from the case of London should also be made for people to understand that London's lost over 4,000 human beings within a short time because of air pollution. And that is like locking down a whole city. It can happen in your own city if you do nothing about it. So small steps, not an overnight achievement, but small steps towards mitigation of air quality. And we have the chances, like the way they are greening now. Trees are good captures of some of the species which are bad in terms of air quality. Reducing traffic from the roads involve efficient transportation system. And security, obviously, when you are dropped by public means. So there are many things I would put in one pot, and these are the ones which can encourage the future of implementation to mitigate air quality properly. Thank you.
Thanks, that's great. Dr. Opinde?
Thank you, Dan, and thank you, Professor Michael. Professor Michael has actually indicated some of the key barriers to clean air. One of them would be also weak enforcement regime within the country, the enforcement regime. Even for the pieces of legislation that are there, the big question would be, what really weakens the enforcement? The knowledge base is one thing. On one hand, we have knowledge base. The other hand, we have issues to do with the resources in terms of maybe the right resources to help enforce. Because in some cases, you find you'd want to actually, the enforcers would want to enforce a certain issue, enforce issues of air quality, but they are ill-equipped and they can actually be challenging the court of law. So for me, I think investment in that by itself would improve that, because it's a barrier. The other thing is awareness, of course, which Professor Guattari has mentioned, but this awareness, I'm looking at it from the perspective that it should be awareness directed to policy makers, member of parliament, the county assembly members, so that they're able to see sense in actually having budget lines for some of these items, so that we have resources. Another barrier for me is, of course, we've mentioned it, is coordination and overlaps within the legislation and the policy framework. And this sometimes would inadvertently weaken the enforcement regime. So who is to take what and at what level? And sometimes there's a blame game from one agency to another. That itself weakens as a barrier to clean air. And another one for me would be public participation. Not only informing them, but involving them. I know of some projects like the citizen science that have actually involved the public in the slum areas of Nairobi, and somehow it is helped to create awareness. But apart from that, it's also something that actually helped in transforming their way of doing things because they practically experience it. So public participation from the research perspective, and also public participation in the policy, this other policy side of it. Thank you.
Thanks, Godwin. Some really great points there with public engagement at the end. I think that's absolutely critical, not just informing them, but getting them involved and through citizen science and collecting data and really getting them engaged. Great points. So I'd like to go to Priyanka next.
Thank you. I mean, I think we've touched on so many things. I'm going to actually, in the chat, I'm going to just post a link. So I did a review of all of the evidence that has been accumulated by so many scientists on air pollution in Nairobi. And I just want to reiterate that we do have a good understanding of the sources, because so many of these studies have shown consistent results. We know that there are many people, especially traffic policemen, people who sell goods by the side of the street, sort of mechanics or people who work in automobile shops. We know that there are groups of people who are more vulnerable to air pollution. And so I think that we need to act on the evidence that we've gathered, gather more evidence, increase awareness about this issue through citizen science, etc., as the previous panelists have announced, and develop an integrated sort of policy approach to this problem.
Thanks, Priyanka. So a call for action that we're ready. We have the information, we have the sources, we have the data. We're ready to take action. Good points. Finally, I'd like to call on Darby Jack.
Sure, I'll be very brief. I'll say the biggest barrier is political will, and what the public can do is to educate themselves, their family members, their peers, advocate, and vote.
Brief, but very salient points there. Very, very well said. Okay, so I think we're coming up on time. I would just like to say a quick final couple of words here, and just say thank you to all the participants for attending and for listening. We hope that you were able to gain something out of our panel today, and that you were able to learn something. I'd also like to thank the Columbia Global Center and all the staff for organizing. And then last but not least, I'd like to thank each of the panelists for giving us their time today, especially in Kenya, where it's already kind of quitting time in the evening. So thank you all very much. Does the Columbia Global Center want to say any last few words before we depart?
Yes. Thank you, Dr. Daniel, again for that wonderful discussion. And thank you, panelists. Thank you, Darby. Thank you, Priyanka, Prof. Michael, and Dr. Godwin. We really appreciate you. And to our audience, we are privileged, and it's an honor to have you join us again. And we want to say that we'll keep you posted for our upcoming webinars and other events. Follow us on Twitter at CGC Nairobi, follow us on Facebook at CGC Nairobi, and also other social media platforms. We'll also appreciate feedback from you, and we want to wish you a restful evening and enjoy the rest of your day. Thank you so much and glad to have you. Thank you.